Welcome to Outside the Box with CB. I'm CB, and I'm going to give you my outside the box take on vaccine mandates and why I have always believed you should never have taken the jab to begin with. Well, I'd say that they have me labeled an anti-vaxxer, and that's not quite true. You see, I took allergy shots as a child. My father was a pharmacist. My folks ran drugstores. I took the first rubella shots, went to a high school that I was lucky to go to because of polio. They had a ramp, at every entrance. And I broke both my legs snow skiing, so I was lucky those ramps were there. And I've had all kinds of vaccines and been to the doctor and stuff all my life. Actually, my doctor did. He committed suicide a while back. It was very disturbing. But the point is that I'm not an anti-vaxxer. I'm opposed to the mRNA vaccines, experimental vaccines. And if you read my profile on Twitter, you'll understand that I've been out here since 2013 trying to tell you that your government is run by a criminal enterprise. It was taken over. You don't want to listen to me, but it's true. Joe Biden's the greatest traitor this country has ever known. And you guys put him right into the presidential seat. So I'm going to make the point that it's not that I'm an anti-vaxxer. It's that I think your government is criminal, and I would not put it past them with what I know and have seen in my analysis of the financials, the legal. I analyzed this country's books kind of like I was a forensic auditor. So I looked at, the law and what took place and what was taking place financially, what the legislators were doing and what was going on in the back rooms of the courts and what was being said in the newspapers. I have all the executive, legislative, and legal background behind what happened exactly to our constitutional rights to due process and the rule of law in America. It ain't pretty. Okay, so it's rude. So let's take a look here. This is KHN Morning Briefing, Tuesday, March 17th, 2020. We're going to keep track of these dates and times, so to speak. This was KLN Morning Briefing's put out this full issue. First human test subjects injected with experimental coronavirus vaccine as trial kicks off. So the first vaccines were done on Monday, March 16th, 2020. And let me read what it says here. On the first day of the trial, 4 healthy volunteers were given the test vaccine developed by scientists at the National Institute of Allergy and Infectious Diseases and Moderna Incorporated. Meanwhile, Pfizer is also working to develop a vaccine with a German company. Such rapid development is unprecedented. But experts warn that even if one works, a vaccine will still not be broadly available for 12 to 18 months. And again, March 17th, 2020. I'm jumping in here with some new information as Peter Navarro received a subpoena from the January 6th committee. And I'm looking at Peter's early life. I found common threads of detail worth observation. For instance, Peter was born in Cambridge, Massachusetts. He earned a Master's of Public Administration from Harvard University and the John F. Kennedy School of Government in 1979. A position for Peter was created as Director of the White House National Trade Council during the Trump administration. And on January 29, 2020, Navarro issued a memo warning that the novel coronavirus could evolve into a full-blown pandemic, imperiling the lives of millions of Americans, and that the worst-case pandemic scenario should not be overlooked. In February 2020, biologist Stephen Hatfield became Navarro's advisor to the coronavirus. Now let's take a look at who Stephen Hatfield is. Here we go. Stephen J. Hatfield is an American physician, pathologist, and biological weapons expert. He became the subject of an extensive media coverage beginning in mid-2002 when he was a suspect in the 2001 anthrax attacks. His home was repeatedly raided by the FBI, his phone tapped. Interesting characters we have working in the Trump administration. And come out today, so I'm going to use it. It says the first COVID-19 case in Massachusetts was detected 2 years ago. This is dated February 1st, 2022. It says it has been 2 years since COVID-19 case was confirmed in Massachusetts. On February 1st, 2020, a UMass Boston student in his 20s who had traveled to Wuhan, China, was diagnosed with the first documented case in the state. At that time, health officials told the public to keep living life. Right now, we are not asking Boston residents to do anything differently, said Rita Neves, intern executive director of the Boston Public Health Commission back in 2020. The risk to the general public remains low. I find it fascinating that, Fauci and his wife, and there's so much tied in with Boston and Massachusetts. But anyway, next, had a case confirmed on February 1st, 2020. And then we had a trial of the first vaccine on March 17th, 2020. I'm sorry, but that's, not a whole lot of time between the time they first had a case and the first time they're injecting somebody with a vaccine, right? On the other hand, see, I do remember somebody coming down with this back in November 1st. And so maybe Massachusetts wasn't the first case, right? Just pointing that out. Doesn't really matter, because the point is, we had the first confirmed case in Boston, Massachusetts in February. By mid-March, we had a test vaccine on trial. Now let's listen to Dr. Fauci describe the event on March 18th. But first, just let me say, I spent my career on complex solution design, testing, and implementation of programming in large-scale financial institution consolidations. And I would think testing on the human body, and especially the immune system, should be a highly specialized, deeply detailed, and thoroughly tested effort. The potential for errors is enormous, and the variance to principles a prime enemy of procedural success. Variance is the enemy. Now let's listen to Dr. Fauci 2 days after his initial test subjects were injected.
Is that as soon as we got the sequence of the virus from the Chinese, we pulled it out of the public database and stuck the gene into a vaccine platform and worked on it literally within a day of when it came out. 65 days later, namely 2 days ago, we gave the first injection to a normal volunteer for a phase 1 trial to see if it's safe. That's the fastest that's ever been done. That's the good news.
Okay, so Dr. Fauci has just told you that 65 days earlier he started on the vaccine. So January 31, February 28, March 16. So he had that all up, 75 days. He started on January 10th, right? Okay. And now he's injected this vaccine, created more rapidly than ever done before. And variance to procedure is the enemy. Acceleration causes more accidents when working in complex environments. But he's got this vaccine created.
The challenging news is that even at that rocket speed, it's going to take a few months to show that the initial safety is okay. Then you go into a phase 2 trial, which instead of involving 45 people, which we have in the phase 1 trial, it involves hundreds if not thousands of people. That will take another 6 to 8 months to even know if it works. So at the fastest we can go, it's going to take a year to a year and a half to know if we have a vaccine that we can use.
So now Dr. Fauci's told us he's injected this vaccine created more rapidly than ever done before. He's going to give his initial patients a few months to ensure they live. Then 6 to 8 months on a larger sampling. So he's telling you, they should know around mid-March 2021, they should have an idea about the vaccine's initial safety by then.
There's another element to safety, and that is if you vaccinate someone and they make an antibody response, and then they get exposed and infected, does the response that you induce actually enhance the infection and make it worse?
So Fauci intends to give his initial patients a few months to ensure they live. Then 6 to 8 months on a larger sampling. So he's telling us they should know around mid-March of 2021 or even as late as September, they should have an idea about the vaccine's initial safety. Then there's another element to the vaccine safety that if you vaccinate someone and then they get infected, does the vaccine's response actually enhance the virus itself, the infection? Not good. I mean, that's a red flag, don't you think?
And the only way you'll know that is if you do an extended study, not in a normal volunteer.
I'm sorry. I don't get that, do you? Not a normal volunteer. And the question is, does the vaccine make an infected person worse? They need a special test subject for that? They can't tell from the initial test subjects whether the vaccine made them worse? Did he just invent a justification for exposing the population to a test vaccine with a fallacious argument? I think you should listen to him again.
There's another element to safety, and that is if you vaccinate someone and they make an antibody response and then they get exposed and infected, does the response that you induce actually enhance the infection and make it worse?
I stopped right here to ask you, I want you to answer me these questions. How do I know if my vaccine actually works without exposing my test subjects to contracting the virus? Or how will I know the vaccine responds to the virus when exposed, if not from my test subjects? Furthermore, are we not going to evaluate this first group of 45 to verify that the potential for the previous fatal mistakes does not occur in this warp speed vaccine? That sounds reckless, just totally reckless, or something else. Are they going to ensure these known fatal performance issues are occurring in the initial test plugs or not? So, why wouldn't they go on those first 45, expose them to the virus, and then find out whether these fatal performance issues have occurred on their first test subjects before they move ahead to a second group anyway? As a testing manager of something like this, I never would have. Especially if I didn't know specifically what had caused those previous issues and ensure that they're not a problem in the initial vaccine trial. No way.
Who has no risk of infection, but in people who are out there in a risk situation.
So I can't be sure whether this is ignorance or malice. If you know prior vaccines have made individuals more likely to catch a virus, or actually made a virus worse, then why, knowing these happened before, would you not consider the risk to your initial test subjects? Wouldn't you want to evaluate whether these risk factors actually were found to have occurred in your test subjects before you seek to give the masses this vaccine?
This would not be the first time, if it happened, that a vaccine that looked good in initial safety actually made people worse.
So if it happened, it would not be the first time a vaccine looked good in initial safety and actually made people worse. That's no big deal. It just killed them. And, well, it's happened before, so if it happens again, it's no big deal if it kills them. Or causes extensive long-term damage. Maybe. I don't know. It just don't sound good to me.
It was the history of the respiratory syncytial virus vaccine in children, which paradoxically made the children worse.
I said, oh, wait a minute. As your testing review manager, that's a red flag. You said paradoxical. And what do you exactly mean by paradoxical? Because I take that to mean seemingly absurd or self-contradictory. Which to me means, really, you don't know why it didn't work. And so as your manager, I say, you go back to the drawing board and come back when you know precisely why it didn't work and what your solution for it was.
One of the HIV vaccines that we tested several years ago actually made individuals more likely to get infected.
So, I'm sorry, you said you had an early HIV vaccine which paradoxically made a person more likely to catch the virus. So, you're saying it's possible the COVID vaccines might make it more likely for individuals to catch the virus. So like if they get a shot, then they might actually be more inclined to get COVID than if they had not had the shot. Or if they'd had 2 shots or 3 shots, would they get more and more inclined? Or do you know?
So you can't just go out there and give
A little recap here. So Dr. Fauci just said you can't just go out there with an experimental vaccine. We will know its safety and efficacy at minimum until March 2021. Oh, but we have made vaccine caused higher rates of infection. He didn't bother mentioning that he also had a failure of the mRNA vaccines used on the Hendra virus in animal studies. I'm sorry. Did you notice Dr. Fauci provide any information on how they had addressed these previous vaccine failures? Or that they understood how to avoid these problems? Did Dr. Fauci express any specific need or intent to watch for these potentially deadly side effects carefully? Don't worry if these vaccines cause people to be more susceptible to catching COVID, or that the vaccines might make them worse and kill them. Be thankful Dr. Fauci finished in record time. Now I give you former President Donald Trump and ask, you realize specifically this presentation is done on December 8, 2020, a full 3 months prior to Dr. Fauci's earliest date for testing completion. And remember, the good doctor gave you a fallacious excuse for testing it on an unvaccinated population.
Journey for all of us. It's been an incredible success. We're grateful to be joined by Vice President Mike Pence, who has done an absolutely incredible job on the coronavirus task force. Mike, thank you. Stand up, Mike. Great job. We're here to discuss a monumental national achievement. From the instant the coronavirus invaded our shores, we raced into action to develop a safe and effective vaccine at breakneck speed. It would normally take 5 years, 6 years, 7 years, or even more. In order to achieve this goal, we harnessed the full power of government, the genius of American scientists, and the might of American industry to save millions and millions of lives all over the world. We're just days away from authorization from the FDA, and we're pushing them hard, at which point we will immediately begin mass distribution. Before Operation Warp Speed, the typical time frame for development and approval, as you know, could be infinity. And we were very, very happy that we were able to get things done at a level that nobody has ever seen before. The gold standard vaccine has been done in less than 9 months. On behalf of the entire nation, I want to thank everyone here today who has been involved in this extraordinary American initiative. I also want to recognize members of my administration who have worked tirelessly in this effort. Alex Azar, please, Alex. Where's Alex? Thank you, Alex. Great job. Monsef Slawi, where are you, Monsef? Thank you very much. Great job. A man who's now going to be very important, General Gus Perna. I have no doubt about it, right? Logistics. Jared Kushner's worked so hard. Where's Jared? Jared, wherever you may be. Thank you, Jared. Dr. Deborah Burks. Deborah? Thank you very much, Deborah. Admiral Brett Guar. Where is Brett? Great job you've been doing, Brett. Surgeon General Jerome Adams. Jerome, thank you very much. Terrific. Dr. Robert Redfield. Robert, thank you very much. Appreciate it. Administrator Seema Verma. Seema, thank you. Dr. Peter Marks. Peter. Where's Peter? Thank you. Paul Mango, Adam Bowler, and Brad Smith. Thank you very much. Great job. Thank you all very much. Incredible job. And many others also. Many, many others. We're also grateful to be joined by Governors Greg Abbott. Where's Greg?
Let's take a quick look at the FDA's COVID-19 vaccine website. I'd just like you to see here that these vaccines were authorized for emergency use. And then I want you to ask, could that emergency use authorization explain how President Trump was announcing the vaccine's hailed success 3 months ahead of the expected testing schedule? Of research and integrity. He said, while the vaccines may have been authorized for emergency use, they were most definitely experimental in nature, if not actually known to be deadly, as were the mRNA vaccines used on horses in Australia. You can see that it's a violation of the Nuremberg Code to use experimental drugs on a patient without express voluntary consent, which would mean that mandates are absolutely a violation. And if you read my profile on Twitter, you'll understand that I've been out here since 2013 trying to tell you that your government is run by a criminal enterprise. It was taken over. You don't want to listen to me, but it's true. Joe Biden's the greatest traitor this country has ever known. And you guys put him right into the presidential seat. So I'm going to make the point that it's not that I'm an anti-vaxxer. It's that I think your government is criminal. And I would not put it past them with what I know and have seen in my analysis of the financials, the legal. I analyzed this country's books kind of like I was a forensic auditor. So I looked at, the law and what took place and what was taking place financially, what the legislators were doing and what was going on in the back rooms of the courts and what was being said in the newspapers. I have all the executive, legislative, and legal background behind what happened exactly to our constitutional rights to due process and the rule of law in America. It ain't pretty.